Everyone who is admitted to hospice has to have a terminal diagnosis and an evaluation of the specific criteria of that diagnosis. We paint a picture to Medicare, and that this patient is ready and meets the hospice admission criteria. Admission is most often not black or white, and each patient, of course, is an individual and may have several disease challenges. However, in this series, we will review the specific requirements for the major terminal diagnoses. And in alphabetical order, we'll get started with ALS, or amyotrophic lateral sclerosis. ALS is a progressive and degenerative neurological disease. To be admitted to hospice for ALS, there must be an evidence of progression of the disease over the past 12 months. The patient must now be chair or bed bound with total assistance to pivot from the bed to the wheelchair. They're no longer able to bear weight and balance on their own. They must have some dysphagia or some swallowing problems and possibly require pureed food. Swallowing is generally getting worse, and there is coughing or choking when oral intake is given. They have slurred speech and are often unable to easily and effectively communicate their own needs. They are dependent on all ADLs, dressing, bathing, feeding, toileting, and they must have at least one of these following things. A, critically impaired breathing, and this might include a decrease of vital capacity to less than 30%, significant dyspnea at rest, perhaps the use of accessory muscles. They're using med-neb treatments. They're on oxygen at rest. They are dependent at rest, and their O2 is less than 90. They might even be cyanotic. They have also declined artificial respiration. So if no respiratory issues, they have to have perhaps this, critical nutrition impairment. Oral intake is insufficient to meet their basic nutritional needs. They have progressive and continued weight loss. They look cachectic. They're dehydrated. They have hypovolemia. There is also an absence of artificial feeding methods like a G-tube. The third other issue is life-threatening complications such as recurrent aspiration pneumonia, UTIs that are recurrent, sepsis, fever after antibiotics that is recurrent, and they may have stage 3 or 4 decubitus ulcers. Remember, as in all hospice admissions, it is not always black and white. It is the responsibility of you, the evaluating or admitting nurse, to collect information from the family, the history, and the patient during your admission. The physical evaluation is, of course, really important. The overall picture then, along with all other information related to other health challenges, such as other diagnoses, and the living situation, that's all taken into account when discussed with the medical director to determine whether the patient meets the Medicare hospice admission criteria. Become familiar with the criteria for each of the major diagnoses. Be a detective, be observant, listen so closely even to what is not being said, and advocate for that patient that's right in front of you. And of course, watch our daily video, send in your questions for our blog, use our booklet to care for the patient once that patient is admitted, and remember our motto, care is treatment.